So for the first story of the day, we're talking about these racist textbooks in nursing school. These nursing school textbooks that people are losing their minds over. All right, so before we even jump into it, let me just say, calm the hell down. It ain't that serious. It just ain't that serious. But if you don't know what I'm talking about, this is what happened. So mass-produced book, and fun fact, I used, I think, a volume, a type. When I was in nursing school, we did this concept-based book. It was from Pearson, and I'm pretty sure it was the same type of book. It looks like the same goddamn thing, but we used obviously a previous volume. I don't think it's the current volume. I did not go check in my nursing textbook. I never want to see my nursing textbook ever again. But with these mass-produced nursing textbooks in their culture and diversity section, where they were trying to be culturally sensitive and they were trying to show what other cultures feel specific when it comes to pain, how they, respond to pain. This is what they decided to put in their textbooks. Now, you tell me if this is pushing crazy, insane stereotypes, or if this is actually culturally sensitive. Let's find out. So, number one, Jews may be vocal in demand assistance. Yeah, Jews. Not Orthodox Jews, not Jews in the Bronx, not Jews in Israel, just Jews. Jews everywhere may just vocalize and demand assistance. Okay, all right. Blacks. Yep, that's all it is. Blacks often report higher pain intensity than other cultures. Are you talking about blacks in Ghana? Are you talking about blacks in South America? Are you talking about blacks in South Africa, in Uganda, and African American blacks? Which kind of blacks are you talking about? Because there's billions of blacks in this goddamn planet. Who knows? Only Pearsons. Let me just finish this out because it's just insane. Indians who follow Hindu practices believe that pain must be endured in preparation for a better life in the next cycle. Okay? Arabs may not request pain medicine, but instead thank Allah for pain if it is the result of a healing medical process. Okay? Hispanics may believe that pain is a form of punishment and that suffering must be endured if they are to enter heaven. Native Americans may prefer to receive medications that have been blessed by a tribal shaman. Okay, so they do put the that caveat in each and every statement that they use, and they say may. A Hispanic may feel this way. A black may say this. A Jew may do this. It doesn't matter. This is fucking bullshit. All right, so let me just, just a shout out to all nursing students out there. Just skip this section, right? Just don't even skim it. Don't even look at it because this is absolutely ridiculous. This is never going to be on the NCLEX. So outside of that specific nursing professor that's insane that wants to test you on this craziness, but this is not going to be on the NCLEX. So you don't need to know this, number one. Number two, when you actually are a nurse, I don't give a shit if you were the professor of African studies and you know Uganda's history and the culture and the people like the back of your goddamn hand, right? If you go into a room as a nurse and you ask a patient that's from that culture, wherever you know the best in the human world, you know that culture, right? And you ask that person, or you just assume you know what that person feels, it's going to be wrong. 99.9% of the time you are going to be wrong if you just assume based on your wealth of knowledge, right? So this is obviously bullshit. The correct thing to do when you're doing cultural and diversity and, that whole sensitivity bullshit, the best thing to do is ask the goddamn person. No matter what they say, no matter how they say it, right? If they actually say it, and if you want to talk to them, if someone is refusing pain medication because of a cultural thing, try to ask them why and go through that with them. It doesn't matter where they're from, right? You can make all the assumptions you want, but just use your clinical judgment. You look at a patient, Jew, black, white, Native American, whatever, they oohing, ahhing, guarding, they in pain, their legs cut off, they bleeding out their goddamn legs, right? And you say, are you in pain? Would you like some pain meds? And they say, while they're crying and biting on the towel, and they say, no, I'm in no pain. You can explain to them, it's not necessary for you to go through this pain. If it's a cultural thing, gotta respect it. But it doesn't matter. This entire section is bullshit, right? This entire section, I never understood, right? Because every patient you talk to, you're going to ask them specifically and pull out all the information you can from them. So making these assumptions based on cultural norms, wrap this bullshit up. Let's just wrap it up. Wrap it up. All right. Moving on.